Hi, I'm Dr. Gary Arthur, and I'd like to introduce you to one of my favorite new patients, Ray George.
Hi.
And Ray's got an incredible story. We started working together about 10 weeks ago, and you know, it's stories like Ray's that make me glad that I chose the career I did as a doctor of natural health care, because when you see people really turn their life around and get their life back and get healthy again, there's nothing like it. It's such a sense of accomplishment and lets me know I'm on track, and I just Ray wanted to share his story, and even if you're not able to ever come experience you know, care here, hopefully in your area, if you're looking on the internet, you can find a natural health care provider in your area that can hopefully help you if you're dealing with some challenges that you're not getting the success that you'd like to so far. So this is my friend Ray George.
Hi, my name is Ray George, and about 9 months ago I had been suffering from chronic fatigue immune dysfunction syndrome for about 15 years. And I've had my ups and downs, and I learned to live with it, and I would rest a little in the afternoon and basically go about a normal life. About 9 months ago I had a massive relapse, and the first thing that happened is I could not sleep at all. I really wasn't suffering from insomnia, the kind of insomnia you get when you miss a few hours sleep. I couldn't sleep at all, and so I was desperate. I went from, tried everything I could, ended up on some pretty heavy drugs. Then I developed very serious health problems with my throat, extreme chest pain. I went to the emergency room 4 nights in a row. I was in desperate pain. I had nowhere to turn. I spent thousands of dollars on all kinds of diagnostic tests, got me absolutely nowhere. I went home, still was going to bed every night with this horrible chest pain. Ended up going to the emergency room 7 times. I had all kinds of in-depth tests. All of them came out negative, which is fine, except that I was still not I couldn't live. I was in pain 24 hours a day. I couldn't sleep. I was in desperate depression. Basically, I was having suicidal thoughts very frequently because the life I was living wasn't even worth living. Finally, through a therapist, I was able to get the idea that maybe applied kinesiology could help me. And a friend of mine who was a therapist knew Dr. Gary and was taking his mother to Dr. Gary, and she was doing immensely better. So I said, well, I've never heard of this thing, but I'll give it. This is the last thing I'm going to do, and then I'm just going to die. And that's what I did. I'm just going to die because I couldn't live. I was getting no joy out of living. It was torture. So when it came down to Gary, he started asking me various questions, testing me for certain substances. I gave him as full a background as I could. We got some of the blood tests that came from the ER, and almost immediately I started feeling better. The pain I had, which had not budged for 6 months, immediately started getting better. I got a little bit of like a 10% reduction in pain after the first week. By a month it had gone down to maybe 50%. Right now we're about a month and a half and it's 80% gone. I had spent thousands of dollars, seen all kinds of doctors, had all kinds of diagnostic tests, which all came out normal, and I was tortured.
How many meds were you on?
I was on, when I first came to see Dr. Gary, I was on 7 different drugs. Now I hate drugs, but this just came as a result of being desperate for the last 9 months rather. The last 9 months of my life, you know, when you're desperate, you'll look for anything that'll work. Well, none of that really helped me very much. But Dr. Gary had helped me from the very, very beginning. And not only that, but I was in a real desperate state of mind. I had tremendous anger towards the medical profession. Unfortunately, Gary saw a lot of that overflow, and one of the greatest things is he never allowed it to change our relationship. He treated me with extreme kindness, no matter how nasty I got. And you know, that, I think he realized that there was another me underneath all that frustration and anger. And now he's beginning to see a little bit of that. So I am deeply, deeply, deeply indebted to Health and Balance and Gary, and the methods that he uses, which are all make perfect sense in terms of the human body. I have no intention of seeing anyone else. I'm just overjoyed. I feel like I've been let out of prison. I have a life. I have my life back, and that's thanks to Gary.
Oh, that's awesome.
Yeah.
Wow. Almost gets you teary-eyed, doesn't it? You know, the simple things a lot of times are the best, and a lot of times they're overlooked. And what I tried to just think about with Ray's case is that something has to be interfering with Ray's body healing itself. There has to be something stressing the system, because our bodies are designed to heal themselves, and if they're not, something's interfering with that normal pathway. And that's what I try to do is look, where is the stress, where's the interference, and we try to, you know, categorize it in, does he have structural stress, does he have chemical stress, does he have mental emotional stress, does he have energetic stress, stress in the acupuncture pathways, or things like that. And that's what we were able to do in the evaluation, is try to find where are those stressors, where's the interference, and then start to remove those stressors so the body can start to heal itself. And then, of course, his part came in where he had to be compliant. You know, he had to get the care. He had to, you know, change his diet. He had to take the supplementation that we recommended. He had to get in touch with the emotions that he had that were, you know, also blocking things, and we had to start moving through some things. So without a patient that's sometimes desperate, a lot of times people aren't really willing to make the changes. But, you know, if you look at where things are going to go, if they continue on, then you know you've got to make a change, otherwise they're only going to get worse. And it's going to take work, and you're going to have to be compliant and dedicated and committed, and you're going to have to pay the price if you want to get the prize, you know. So Ray's been willing to do it. You know, without giving a lot of specifics, we just found things in each one of those systems, and that's what we've been doing on each visit, is just trying to continue removing the stress so his body can go ahead and heal. And fortunately, he's been one of great success stories and one of my new favorite patients. And thanks for taking the time to listen.
Thank you.